Question 1. An operator is preparing to take a radiograph on a patient. Which of the following actions best demonstrates the Ehlers principle? A. Using a circular collimator instead of a rectangular one. B. Setting the exposure time to the highest possible setting. C. Taking extra radiographs to ensure a good image is captured. D. Using a digital sensor instead of D-speed film. Answer: D. Using a digital sensor instead of D-speed film. This question tests your understanding of the Ehlers principle, which stands for as low as reasonably achievable. The key is to find the option that minimizes radiation exposure while still getting a good image. Using a digital sensor is the correct answer because digital imaging requires significantly less radiation than older D-speed film to produce a quality image. This directly reduces the patient's dose, which is the main goal of Ehlers. For example, switching from film to digital can reduce exposure by up to 90%. Always remember, Ehlers is about choosing the safest option available to get the job done right. Question 2. A dental radiograph shows a dark area where a patient has a carious lesion, cavity. This dark appearance is best described as A. Radiopic. B. Radiolucent. C. High density. D. Low contrast. Answer: B. Radiolucent. This question tests your knowledge of how different structures appear on a radiograph, using the keyword dark area. Radiolucent describes areas on an X-ray that appear dark because radiation passes through them easily, like decay, pulp, or abscesses. The opposite, radiopaque, describes dense areas like fillings or bone that block radiation and look white. A cavity is less dense than healthy tooth structure, so more X-rays pass through and hit the sensor, creating a dark spot. A simple way to remember is, lucent sounds like lucid or clear, meaning X-rays pass through clearly. Question 3. During an exposure, the patient unexpectedly coughs, causing the tube head to move slightly. What is the operator's most immediate concern? A. The image will be blurred. B. The patient received an unnecessary radiation dose. C. The sensor will be uncomfortable. D. The timer on the machine may have malfunctioned. Answer: B. The patient received an unnecessary radiation dose. This question is tricky because it asks for the most immediate concern, forcing you to prioritize patient safety over image quality. While a blurred image is a definite outcome, the primary concern is that the movement resulted in a non-diagnostic image, meaning the radiation exposure served no purpose. This useless exposure is a safety issue because the patient was subjected to radiation without any benefit. Therefore, the need for a retake means the patient will have to receive a second dose of radiation. Think of it this way: a blurry picture is an inconvenience, but unnecessary radiation is a safety violation. Question 4. The primary purpose of the lead collimator in the dental X-ray tube head is to A. Remove the low-energy X-rays from the beam. B. Restrict the size and shape of the X-ray beam. C. Increase the penetrating power of the X-ray beam. D. Filter out the scatter radiation coming from the patient. Answer: B. Restrict the size and shape of the X-ray beam. This question tests your knowledge of specific X-ray machine components, focusing on the collimator. The collimator is a lead plate with a hole in it designed to narrow the X-ray beam down to a smaller, more focused area. This action limits the amount of tissue exposed to radiation, protecting parts of the patient's face that don't need to be imaged. For example, a rectangular collimator shapes the beam to be just slightly larger than the dental sensor. An easy way to remember is that a collimator confines the beam to the target area. Question 5. An operator wants to produce a radiograph with many shades of gray to help see the difference between early-stage bone loss and healthy bone. Which settings should be adjusted? A. Milliamperage, mA. B. Exposure time. C. Kilovoltage peak, kVp. D. Film speed. Answer: C. Kilovoltage peak, kVp. This question asks how to control the number of gray shades, which is the definition of contrast. The key term is many shades of gray, which describes low contrast, and the setting that controls this is the kilovoltage peak, kVp. Increasing the kVp produces a beam with more penetrating power and results in more shades of gray, low contrast. Lowering the kVp results in fewer shades of gray, high contrast, which is more black and white. Think of kVp as the quality control knob that adjusts the contrast scale. Question 6. If a film is accidentally placed in the fixer solution before being placed in the developer, how will the final image appear? A. Completely black. B. Completely clear. C. Dark with light spots. D. Light with dark spots. Answer B. Completely clear. This question tests your understanding of the chemical processing steps in the correct order. The fixer's job is to remove the unexposed silver halide crystals from the film emulsion after the developer has turned the exposed crystals black. If the film goes into the fixer first, the fixer will wash away all the silver halide crystals before the developer has a chance to create an image. Without any crystals left to be developed, the film will come out completely clear, as if it was never exposed at all. Just remember, developer builds the image, and fixer clears the rest. Skipping the first step means no image can be built. Question 7. A patient states they have a very sensitive gag reflex. Which of the following radiographs should the operator attempt to take last? A. Maxillary anterior periapicals. B. Mandibular posterior periapicals. C. Maxillary posterior periapicals. D. Bite wings. Answer C. Maxillary posterior periapicals. This is a practical question about patient management, requiring you to know which sensor placements are most likely to trigger a gag reflex. The maxillary posterior region, especially the molar area, is the most sensitive and most likely to cause gagging when a sensor is placed. By saving this difficult area for last, you can capture all the other images first without the patient becoming uncomfortable early on. If the patient begins to gag, you have already successfully completed most of the full mouth series. Always work from the front of the mouth to the back, starting with the less sensitive mandibular teeth. Question 8. The latent period in radiation biology is the time between A. The beginning and end of the X-ray exposure. B. Placing the film and seeing the processed image. C. Radiation exposure and the appearance of clinical signs. D. The patient entering the clinic and leaving the clinic. Answer C. Radiation exposure and the appearance of clinical signs. This question tests your knowledge of a specific term in radiation biology, the latent period. This term refers to the delay between the moment the body cells are exposed to radiation and the time when the damage becomes visible as a clinical sign or symptom. Depending on the dose, this period can be hours, days, or even years long. For example, the tissue redness from a radiation burn, erythema, doesn't appear instantly. It shows up after a latent period. Think of it like a sunburn. The exposure happens, but the redness and pain develop later. Question 9. Which of the following is considered an example of a somatic effect of radiation? A. A birth defect in a patient's future child. B. A mutation in a sperm cell. C. The development of cataracts. D. A genetic mutation passed to the next generation. Answer C. The development of cataracts. This question asks you to distinguish between the two main types of radiation effects, somatic and genetic. The keyword is somatic, which refers to all body cells except for the reproductive cells. Therefore, a somatic effect is damage that occurs to the person who was exposed but is not passed on to their children. Cataracts, cancer, or hair loss are all somatic effects, while genetic effects involve damage to reproductive cells, sperm or egg, and can cause mutations in offspring. Just remember, somatic effects stay with the person who was exposed. Question 10. To protect themselves from scatter radiation, an operator should stand at an angle of ________ to the primary beam. A. 0 to 45 degrees. B. 45 to 90 degrees. C. 90 to 135 degrees. D. 135 to 180 degrees. Answer C. 90 to 135 degrees. This question tests the specific rules for operator positioning and safety. The safest place for an operator to stand is at an angle between 90 and 135 degrees to the direction the X-ray beam is traveling. Standing in this zone minimizes exposure because the least amount of scatter radiation is directed toward these areas. Standing closer to the path of the primary beam, either in front of or behind the tube head, would significantly increase the operator's dose. As a rule of thumb, always remember to stand at a right angle or wider to the beam's path. Question 11. What is the primary reason for using a lead apron with a thyroid collar for intraoral radiographs? A. To protect the patient's entire body from radiation. B. To prevent the primary beam from reaching the patient's torso. C. To protect the patient's reproductive and blood-forming tissues. D. To keep the patient from moving during the exposure. Answer C. To protect the patient's reproductive and blood-forming tissues. This question asks for the primary reason for using a lead apron, making you choose the most accurate and specific answer. While it does protect the torso, its main purpose is to shield the most radiosensitive organs in that area, such as the reproductive organs and blood-forming tissues in the bone marrow. The thyroid collar has a separate, specific job of protecting the thyroid gland. The apron does not protect against the primary beam, which is aimed at the mouth, but rather against scatter radiation. So, the most precise answer is about protecting those specific sensitive tissues. Question 12. A dental radiograph that appears too dark has A. Low contrast. B. High contrast. C. Low density. D. High density. Answer D. High density. This question tests your understanding of radiographic terminology, specifically the term for overall darkness on an image. Density refers to the overall blackness of a processed radiograph. An image that is too dark, overexposed, is described as having high density, meaning too much radiation reached the sensor and overenergized the crystals. Conversely, an image that is too light, underexposed, has low density. Remember, a dense fog is hard to see through, but a dense radiograph is dark because it's packed with black-silver particles. Question 13. An operator takes a bite-wing image, but the final radiograph shows a clear, unexposed crescent shape on one edge. This error is called A. Elongation. B. Foreshortening. C. Overlapping. D. Comb cut. Answer D. Comb cut. This question requires you to identify a common positioning error based on its appearance. The crescent shape is a classic clue for a comb cut. This error occurs when the position indicating device PID or cone is not properly aligned with the sensor, causing the edge of the PID to block part of the X-ray beam. As a result, that part of the sensor is not exposed to radiation and remains clear after processing. Think of it as the PID's shadow falling on the sensor, creating a cut in the image. Question 14. In which part of the X-ray tube head are the X-rays actually generated? A. At the tungsten filament in the cathode. B. At the tungsten target in the anode. C. Within the aluminum filter. D. Within the lead collimator. Answer B. At the tungsten target in the anode. This question tests your knowledge of how an X-ray machine works, focusing on where the X-rays are produced. X-rays are generated when high-speed electrons, which are produced at the cathode, slam into the tungsten target, which is part of the anode. This sudden stop of electrons causes their energy to be converted into X-ray photons and heat. The other parts listed, the filament, filter, and collimator, all play important roles, but the anode's tungsten target is the specific spot where the magic happens. Remember, electrons anoint the anode to create X-rays. Question 15. Legally, who is the owner of a patient's original dental radiographs? A. The patient. B. The insurance company that paid for them. C. The dentist who prescribed them. D. The dental assistant who took them. Answer: C. The dentist who prescribed them. This is a tricky legal question that many beginners get wrong. Dental radiographs are part of the patient's official clinical record, and the dentist who prescribed them is the legal owner of the original images. While patients have a right to access their records and can request copies, they do not own the originals. The dentist must maintain the original records for legal and diagnostic continuity. Think of it like a doctor's chart. It's about you, but the physical record belongs to the practice. Question 16. A longer position indicating device, PID, is often preferred over a shorter PID because the longer PID A. is easier to aim and position. B. increases the intensity of the X-ray beam. C. reduces magnification and image distortion. D. allows for a shorter exposure time. Answer: C. reduces magnification and image distortion. This question tests your understanding of the principles behind using different PID lengths. A longer PID places the X-ray source further from the patient, which results in more parallel X-rays striking the sensor. This geometry is better because it reduces both image magnification and distortion, creating a more accurate and sharper picture of the teeth. While it also slightly reduces patient dose due to less beam divergence, the primary image quality benefit is the reduction in distortion. Think of how standing further away from an object when taking its shadow makes the shadow sharper and closer to the object's actual size. Question 17. The purpose of the aluminum filter inside the X-ray tube head is to A. restrict the size of the X-ray beam. B. remove the weak, long wavelength X-rays. C. remove the strong, short wavelength X-rays. D. increase the overall number of X-rays produced. Answer: B. remove the weak, long wavelength X-rays. This question focuses on the specific function of filtration in the X-ray machine. The aluminum filter is placed in the path of the beam to absorb the low-energy, long wavelength X-rays. These weak X-rays are not strong enough to penetrate the patient's tissues to create an image, but they can be absorbed by the skin, adding to the patient's radiation dose without any diagnostic benefit. By filtering them out, the machine produces a higher quality, safer beam. Remember, filtration takes out the useless rays to protect the patient. Question 18. An image appears blurry, and a double image is visible. Which of the following is the most likely cause of this error? A. the patient moved during the exposure. B. the film was placed in the mouth backwards. C. the vertical angulation was too steep. D. the horizontal angulation was incorrect. Answer: A. the patient moved during the exposure. This question asks you to diagnose an image error based on its visual characteristics. The keywords blurry and double image are classic indicators that either the patient, the sensor, or the tube head moved while the X-ray was being taken. This movement causes the image to be smeared across the sensor, resulting in a lack of sharpness and sometimes a ghosting or double image effect. Other errors like incorrect angulation cause distortion, elongation/foreshortening, or overlapping, but not this specific type of blur. It's crucial to instruct patients to remain perfectly still for the few seconds of exposure. Question 19. If a dental assistant is concerned about their occupational radiation exposure, which device should they wear to monitor it? A. a lead apron. B. a thyroid collar. C. a dosimeter badge. D. a digital sensor. Answer: C. a dosimeter badge. This question tests your knowledge of equipment used for monitoring operator safety. A dosimeter badge, also known as a film badge, is a device worn by personnel to measure the cumulative dose of radiation they receive over time. It does not offer any protection, but rather serves as a record keeper to ensure the operator is not exceeding the maximum permissible dose limits. A lead apron protects the patient, or operator in some cases, but the dosimeter is specifically for measuring or dosing the operator's exposure. Think of a dosimeter as a personal radiation diary. Question 20. When using the paralleling technique, an increased object-to-receptor distance is often required to keep the sensor parallel to the tooth. What must be done to compensate for this distance? A. Use a shorter exposure time. B. Use a short 8-inch PID. C. Use a long 16-inch PID. D. Decrease the vertical angulation. Answer C. Use a long 16-inch PID. This question connects two key concepts of the paralleling technique in a tricky way. To get the sensor parallel to the long axis of the tooth, especially in the maxilla, it must be placed further away from the tooth. This increased distance can cause image magnification, so to counteract this, a long PID is used. The long PID increases the source-to-object distance, which compensates for the object-to-receptor distance, resulting in less magnification and a more accurate image. Remember, in paralleling, you need a long PID to make up for the far sensor placement. Question 21. Which of the following anatomical structures would appear the most radiopaque on a dental radiograph? A. Dental pulp. B. Periodontal ligament space. C. Enamel. D. Dentin. Answer C. Enamel. This question tests your knowledge of how different tooth structures appear on an X-ray, using the term radiopaque. Radiopaque means white or light, and it represents dense materials that block X-rays. Of the choices given, enamel is the hardest, most dense substance in the human body, so it will block the most radiation and appear the brightest white on the image. Dentin is slightly less dense and appears light gray, while the pulp and periodontal ligament space are soft tissues that appear dark, radiolucent. A good way to remember is to think of enamel as the tooth's armor. It's the toughest and shows up whitest. Question 22. A periapical image of a maxillary molar is elongated, meaning the tooth appears stretched out and long. This was most likely caused by A. Insufficient vertical angulation. B. Excessive vertical angulation. C. Incorrect horizontal angulation. D. The patient biting too hard on the holder. Answer A. Insufficient vertical angulation. This question requires you to identify the specific cause of an image distortion error. Elongation, where teeth look long, happens when the vertical angulation of the X-ray beam is too flat or insufficient. To get an accurate image, the beam must be aimed at a steep enough angle to compensate for the tilt of the tooth and sensor. If the angle is too shallow, the image gets stretched out. The opposite error, excessive, too steep, vertical angulation, causes foreshortening, where the teeth look short and squat. Question 23. The cumulative nature of radiation means that A. The effects of radiation disappear over time. B. A single large dose is less harmful than many small doses. C. The damage from radiation adds up in the body over a lifetime. D. Only high doses of radiation are considered harmful. Answer C. The damage from radiation adds up in the body over a lifetime. This question tests your understanding of a fundamental concept in radiation biology, the cumulative effect. This principle states that the damage caused by radiation does not fully repair itself, so the effects of multiple exposures add up over time. Even small doses, repeated over many years, contribute to a person's total lifetime radiation burden. This is why we follow the Alera principle so strictly to keep every single dose as low as possible. Think of it like adding a drop of water to a bucket each day. Eventually, the bucket will be full. Question 24. What is the very first step in processing traditional dental film in a manual processing tank? A. Rinsing. B. Fixing. C. Developing. D. Drying. Answer C. Developing. This question asks you to identify the correct sequence of manual film processing, which can be tricky for beginners. The very first step is to immerse the film in the developer solution. The developer chemical is what converts the exposed silver halide crystals on the film into black metallic silver, which creates the visible image. After developing, the film is rinsed briefly before being placed in the fixer. Placing it in any other solution first would either result in a blank film, fixer, or wash away the emulsion water. Question 25. An operator is taking a panoramic radiograph. They should instruct the patient to do all of the following except A. Place their tongue on the roof of their mouth. B. Stand up straight with their spine erect. C. Close their lips around the bite block. D. Place the lead apron on backwards with the opening in the front. Answer D. Place the lead apron on backwards with the opening in the front. This is a tricky except question that tests your knowledge of panoramic procedures. For a panoramic X-ray, the machine rotates around the patient's head, so a double-sided apron or a poncho-style apron is often used to protect both the front and back of the patient. A standard apron worn backwards would leave the front of the patient's torso unprotected as the machine rotates. The other instructions, tongue on the roof of the mouth, standing straight, and closing the lips, are all standard and correct procedures for a clear panoramic image. Therefore, placing a standard apron on backwards is the incorrect action. Question 26. Which of these cells are considered the most sensitive to the effects of radiation? A. Nerve cells. B. Mature bone cells. C. Muscle cells. D. Immature reproductive cells. Answer D. Immature reproductive cells. This question is about radiosensitivity, which is the susceptibility of cells to radiation damage. The general rule is that cells that divide rapidly or are young and not yet specialized are the most sensitive to radiation. Of the options provided, immature reproductive cells are highly mitotic, they divide quickly, and are therefore considered very radiosensitive. In contrast, highly specialized and slow-dividing cells like muscle and nerve cells are very radioresistant, less sensitive. This is why shielding the reproductive organs is a critical part of patient protection. Question 27. When disinfecting a digital sensor after removing the contaminated plastic barrier, what is the most appropriate agent to use? A. A high-level disinfectant like glutaraldehyde. B. An intermediate-level disinfectant. C. A low-level disinfectant. D. Isopropyl alcohol. Answer B. An intermediate-level disinfectant. This question tests your knowledge of infection control protocols specific to radiography equipment. After removing the contaminated outer barrier, the digital sensor, which is a semi-critical item that contacts mucous membranes, must be cleaned and disinfected with an intermediate-level disinfectant. These are hospital-grade disinfectants registered with the EPA that are effective against tuberculosis. High-level disinfectants are too harsh for the sensor's electronics, and low-level disinfectants are not strong enough to kill all pathogens of concern. This ensures the sensor is safe for the next patient. Question 28. If an unwrapped, processed film is accidentally exposed to white light in the dark room for a few seconds, it will appear A. Black. B. Clear. C. Fogged. D. Unchanged. Answer A. Black. This question tests a common processing error related to light exposure. Once a film has been processed, the image is set, but the emulsion can still react to light. If a processed film is exposed to white light, the remaining sensitive silver halide crystals that were not part of the image will become energized and turn black. This additional exposure will essentially overexpose the entire film, causing it to appear dark or completely black. This is why finished radiographs should always be handled and stored away from bright light sources. Question 29. The main advantage of using a rectangular collimator over a circular one is that it A. is easier to align with the sensor. B. can be used with any length of PID. C. significantly reduces the patient's radiation dose. D. produces an image with higher contrast. Answer C. significantly reduces the patient's radiation dose. This question compares two types of collimators and asks for the main advantage of one over the other. A rectangular collimator shapes the X-ray beam to be only slightly larger than a rectangular sensor, which dramatically reduces the amount of tissue exposed compared to a larger, circular beam. This reduction in the size of the beam can decrease the patient's radiation dose by up to 60 to 70%. While it can be more difficult to align and avoid cone cuts, its radiation safety benefit makes it the recommended choice. Remember, less beam size equals less patient exposure. Question 30. If a patient refuses to have radiographs taken, what is the most appropriate first action for the dental assistant? A. Inform the patient that treatment cannot continue without them. B. Proceed with taking the radiographs anyway. C. Document the patient's refusal in their chart and inform the dentist. D. Ask the patient to sign a waiver and proceed with other treatments. Answer. C. Document the patient's refusal in their chart and inform the dentist. This question addresses the important legal and ethical issue of patient consent. Patients have the right to refuse any recommended treatment, including radiographs. The first and most critical step is to listen to the patient and then immediately inform the dentist and meticulously document the refusal in the patient's record. The dentist can then discuss the risks and benefits with the patient, but proceeding without consent or threatening to stop treatment are not appropriate initial actions. Proper documentation protects both the patient and the dental practice. Question 31. The silver halide crystals are found in which layer of the dental X-ray film? A. The protective layer. B. The film base. C. The adhesive layer. D. The emulsion. Answer. D. The emulsion. This question tests your knowledge of the composition of dental X-ray film. The film emulsion is the active layer that is sensitive to radiation and contains the silver halide crystals suspended in gelatin. When X-rays strike these crystals, they become energized and form the latent, invisible image. The other layers, like the plastic base and protective coating, provide support and protection but do not contain the image-forming crystals. Think of the emulsion as the magic layer where the picture is actually captured. Question 32. A panoramic image shows that the patient's anterior teeth appear very narrow and blurred. This error was most likely caused by the patient. A. Biting too far forward on the bite block. B. Biting too far back on the bite block. C. Having their chin tipped too high. D. Not placing their tongue on the roof of their mouth. Answer. A. Biting too far forward on the bite block. This question requires you to diagnose a specific panoramic positioning error based on the appearance of the anterior teeth. In panoramic radiography, there is a specific zone called the focal trough where the image is clearest. If a patient bites too far forward anterior on the bite stick, their front teeth will be positioned in front of the focal trough. This causes the anterior teeth to appear skinny, blurred, and out of focus on the final image. To remember this, think forward and skinny. Question 33. The term penumbra refers to the area of _________ on a radiograph. A. Perfect sharpness. B. High contrast. C. Unsharpness or fuzziness around the edge of an image. D. Dark spots caused by developer splash. Answer. C. Unsharpness or fuzziness around the edge of an image. This question tests your knowledge of a specific term related to image quality. The penumbra is the blurry or fuzzy zone that surrounds the sharp edge of an object on a radiograph. A smaller penumbra results in a sharper, clearer image with better detail. Factors like using a small focal spot on the anode, a long PID, and minimizing patient movement all help to reduce the penumbra. Think of it as the fuzzy shadow effect that you want to minimize for a crisp picture. Question 34. According to the inverse square law, if you double the distance from the radiation source, the intensity of the beam is reduced to A. 1/2, B. 1/3, C. 1/4, D. 1/8. Answer. C. 1/4. This question tests your understanding of the inverse square law, a key principle of radiation physics. This law states that the intensity of the radiation is inversely proportional to the square of the distance from the source. This means that as you move away from the source, the radiation intensity drops off very quickly. If you double your distance, multiply by 2, You must square that number, 2 times 2 is equal to 4, and then take the inverse, which reduces the intensity to 1/4 of its original strength. This law is the scientific reason why distance is such an effective form of protection for operators. Question 35. When preparing to take radiographs on a pregnant patient, the dentist has determined that the images are medically necessary. What is the most important consideration? A. To take extra films to ensure no retakes are needed. B. To ensure the lead apron and thyroid collar are used correctly. C. To have the patient sign an extra consent form. D. To use a short PID to decrease exposure time. Answer B. To ensure the lead apron and thyroid collar are used correctly. This question focuses on the protocol for pregnant patients, emphasizing the most critical safety step. While dental radiography is considered safe during pregnancy when necessary, the standard of care is to be extra cautious with protection. The most important action is to ensure proper shielding with a lead apron and thyroid collar to minimize any potential exposure to the fetus and the mother's thyroid gland. The goal is to follow the Alera principle with extreme diligence, and proper shielding is the cornerstone of that practice for every patient, especially those who are pregnant.